sore throat, common cold, and it goes away. But before the disease of the infection completely leaves the person's body, during that period, they can be transmitting it to others. So there's another group of people that when they get it, they have high fever, they have cough, they present like pneumonia, and after like 14 days, um, they get better, and that's it. And so, but there's a third group of people that once it gets into their system, it overwhelms the entire system. By so basically what it does is like when the way the lung is fashioned by a creator is such that it has this tiny sacs, very very tiny minute sacs that exchanges gas. Carbon dioxide comes out and oxygen comes in. So those masks, what the infection does, it kind of like is like a sac that has a balloon inside it. So when the infection gets into the system, but imagine Nigeria has a population of 200 million people, and you have what is 5% of 200 million? 1% of 200 million is 2 million, and 5% is 5 million. That is a whole potentially a whole community, a whole town. So there are only very few disease in history that can cause that kind of overwhelming death, apart from wars. And that's why you hear nations describing this disease as a warlike situation. So a little bit of um, of the risk factors. So like I mentioned earlier, people that have all these risk factors, elderly, um, people more than 65 years of age, people that have history of heart failure, weak heart attacks in the past, diabetes, especially ones that are not controlled, immunocompromised states like cancers, HIV, uncontrolled, and all of that. These are people that have a higher propensity to get overwhelmed by the disease. Now, when they come to us in the hospital, I don't know how you one would look at it. But somehow, the facility that I work at, SUNY Downstate in Brooklyn, was designated because the state hospital was designated by the governor to be a COVID center. So every so the principle is that everybody that has COVID should come to that hospital, and they need to be admitted. They come to us, and people that don't have COVID, we have them, we have to transfer them to other hospitals. So we really see a lot of cases of this, and subhanallah is really really very scary. It's really really very scary. We see, and it doesn't respect anybody, the rich, the poor, the doctors, nurses, young. We see all of them. Even people that, they say initially they said that people that are young, that are healthy, they don't come down with it. It's a myth. It's a myth. Everybody needs to be careful to be prepared for this. And the other thing, and so what do we do? What do we do with them? So when a patient comes in with a symptom that present like pneumonia, uh, because the ones that don't have low grade fever and all of that, they call their doctor, and the doctor will give them just basic medication, things to break down the fever or to give them strength like painkillers and all of that. And when it gets worse, when they cannot breathe, they have fever uh, that is not getting relieved, then they come to the hospital. So when they come, we admit them to the hospital and we watch them. We put them on oxygen because they cannot breathe, uh, or we give them fever medication every day just to monitor them. So when we monitor them, some people will go in such a way that after a few days, they either deteriorate, they get worse, or they get better, or they don't change. So if they don't change in the symptoms, they are stable, meaning on oxygen. We send them home on oxygen, and we tell them if it gets worse, call 911, call the ambulance, and they will bring you back to the hospital. And or some people after a few days the fever subsides, and then we send them home with the same instruction. If they get worse, you come back. What does it mean if they get worse, you come back? If they get worse, they come back and they need to be on a breathing machine, and that's like almost like a death sentence. So so there's a little bit of there's also this other information that anti-malaria like chloroquine, um, some antibiotic they call azithromycin, um, that they can work for the disease. See, and you hear information from from here and there, but there is no known confirmation that any of these medications work because there's not been any trial, any randomized trial to see whether the medication works. Some people say, oh, they took chloroquine and they got better with it. If they didn't take chloroquine, they probably would have gotten better with it anyway. So as far as we know now, there's no medication or there's no drug that can attack it. So, but the reason why they say chloroquine, why chloroquine has been touted to be a drug that can potentially help them is because the virus behaves like malaria. It attacks the same way it causes the problem. The same way malaria causes problem. That's the way it also causes problem. What does it do? Like malaria, it attacks the red blood cell. And that's why people that have very bad malaria, they may need blood transfusion. They get weak because the red blood cell is the one that carries oxygen around the whole body. So when the virus it attacks a protein on the red blood cell called hemoglobin, it destroys the red blood cell. The person becomes weak. It doesn't have enough oxygen carrying capacity, and that's why they need to be on oxygen and they need to be intubated. So what it does two things that causes death. It destroys the lungs, like I explained to you. It doesn't allow the blood to carry oxygen to the brain, to the heart, to the kidneys, and that's why they shut down. So, the speculation is that if you give them chloroquine, and the chloroquine, what it does, it can inhibit this attachment to the white blood cell. Perhaps it can work. But when we do this, like when we test drugs in test tube, the way if it works, you can give it to humans and it may not work because the environment is completely different. So until there's a randomized trial to prove that it works or it doesn't work, we cannot giving it is only speculation. And mind you, chloroquine is also potentially very toxic. So I will not advise anybody to take it. You hear some people they've been taking chloroquine prophylactically, thinking that okay, if they take it, if they have the virus, not get into them. Chloroquine has potential toxicity too. It can shut down the heart by itself. Like there was a group of husband and wife. This is about maybe about 2 weeks ago. They aired on TV, especially when President Trump was talking about chloroquine being a potential, game changer for the disease. They took it. The husband died from cardiac toxicity. It destroyed his heart, and the wife was also put on life support. But the last I heard of her, she was off breathing machine and was on oxygen, just nasal oxygen, without the tube to help, without the tube to put them on a breathing machine. So so she was saying that, and she actually was interviewed, and she was on an hospital bench. Nobody should listen to the president that is lying. Anybody that thinks it works, it doesn't work, and stuff like that. So chloroquine, even though it's very, we use it a lot. All of us have at one time or the other been in contact with chloroquine for malaria, but it's just by the mercy of Allah, because even malaria, it kills, and so it's a drug that we need to be careful about, because you don't know how you're gonna react to it. Unless it's necessary, we don't give it. So now what we give, some of the hospitals give it, and the CDC doesn't recommend whether the doctors can prescribe it or not. But what it says is that if the doctor reaches has a discussion with the patient, and if they both agree, knowing fully well that it is potentially toxic, it may or it may not help, and the person says, okay, I can give it a try. Then whatever is the consequence, you know that is something that you made an informed decision. Because we do not know, there's no proven uh, the efficacy of the medication or the drug has not been proven. Um, so I guess my message to all of us is this: there's a lot of theories, conspiracy theories of how the virus came about. But what we need to focus, regardless of how it comes or how it came about, it's a virus that kills, and we need to take all the precautions that all of us already know. The so-called social distancing, say keeping 6 feet apart, and using the mask. And I already explained to us how the mask becomes beneficial. It's not that it prevents you from having the disease, but the person that is already infected, if he uses it, is trying to protect his or her neighbor or his other fellow human being. Um, and there's also the concept of wearing gloves. Gloves is it depends on the way you slice it. Because if you put on a glove and you touch everywhere, you put on a glove, you're going to answer your phone, right? Pick up with the glove with the phone, you answer, you touch your ears and all of that with it, and then you take off the gloves and you say, okay, well, everything is clean. But what about uh, what you've touched, the parts of your body, your books, your clothes, the doors in the house, and all of that? So I would not really encourage wearing gloves. What I would suggest is we should uh, just follow the standard hygiene, right? Washing our hands as often as we can, especially when we come in contact with when we go out, and avoid shaking. It's funny, many of these things that are supposed to protect us is what as Muslims we're supposed to be doing. You know, they say we should not shake, especially the opposite gender, and but we do this, but it's potentially therapeutic, or it can prevent infection. And many of these things like social distancing, you see people don't go to bars and nightclubs anymore because of this. So we don't fear Allah, but we fear the virus as humanity. So I guess that's the food for thought. So my take home message is not so much as what I've said so far, because I believe most of what I've just said would have heard it somewhere, someplace, sometime. I guess I'm just emphasizing it from a position of privilege. But the basic principle still remains. I'm not a scholar, but I'm a Muslim. I like to look at every aspect of life through the prism of Islam. And what it tells us is basically that we should fear Allah, we should obey Allah. And regardless of how which situation we find ourselves, like the Prophet said, we should tie our camel. And that's the reason why I'm sure the organizers of this discussion uh, planned it. We're tying our camel, meaning we need to be informed, and then we need to be informed, and we know how to protect ourselves. But we know even beyond that, after we've done all this, which is tying our camel, we still beckon on Allah to protect us as individuals, as families, and as the Ummah and the humanity um, at large. I don't think there's anything I left out. And if I
Okay, thank Dr. Tipsy. We really
no,
appreciate your points and I'm happy we have the rapt attention now with little or no distraction. So without wasting much time, I would like to seek that those that have question and answer should quickly come up with it. I have a question, and let me quickly say this. Anybody that wants to talk can actually unmute himself or herself. There's an unmute button, but want to plead that if somebody has unmuted and is having the floor, let that person finish before you also do same. Or you can also raise your hand, what Pamsa had just done. Okay, let me allow Pamsa to ask his question first. Pamsa, I've unmuted you. Can you please ask your question? You have the floor.
Assalamu alaikum.
Wa alaikum
Assalamu
assalam.
alaikum.
Wa alaikum assalam. That's the question. This is from Sister Nimos.
I said my question.
Okay. What's the question?
Okay. I said, is it possible, is it true that one can be contacted the disease through currency, money?
Okay, that's noted. So he's going to respond to that. I've also have pharmacist Kazim also want to ask his question. Pams, I'm going to mute you back. While pharmacist, we have the floor.
Assalamu alaikum wa rahmatullahi wa barakatuh, sir.
Wa alaikum assalam wa rahmatullahi wa
barakatuh. My own question is, first of all, sir, jazakumullah khairan for the lecture. And the question is, I learned in New York, United States, in New York, North America, that the hydroxychloroquine tablets, which Donald Trump has been championing in US. I learned the doctors in New York has been using for their patients, for those that have been coming up with COVID-19. And I'm not very sure, but I want to know, I want to ask, that's what I'm asking you, if it is true or not. Thank you very much.
Okay.
Okay, so I also have Sister Nimat. Please, you have the floor.
Hello?
Hello?
Yeah.
Hello, can you hear me?
Yes. I can hear you. Hello, I can hear you.
My own question, basically, I'm just putting the COVID together with back to history. When the Europeans came, back to history.
Okay.
When the Europeans came to Africa, rather, they contacted malaria, which normally kills them, unlike the way it's going to kill the blacks.
No.
So I'm now relating it together that is this something similar to that? Because in Africa too, not that malaria doesn't kill us, but until when we have the high fever, that's when we get killed. This care is not taken. So I'm now relating the COVID together with the high fever. That is it possible that something similar to that? Because with the high fever, you get killed easily if care is not taken. So I want to, what's the relationship between the high fever, what's the similarity between the high fever and the COVID?
What fever?
High fever, Akoba.
Oh, eye fever.
Yes.
Okay, because of time, please, I'm going to just allow us to talk for 1 minute now. So I'm going to allow Armstrong to ask a question. I'm sorry if I'm not able to call you, please, because of time, so that the presenter, you can type your question, please. Mr. Tayo Kafo, Mr. Monsoor, please type your question. So, Armstrong, please.
Assalamu alaikum. Can ginger and garlic kill COVID-19?
Okay, that's fine. So I think we got that. Can ginger and garlic do the magic? My own question is, in standard epidemiological studies, what determines where vaccines are being tested? There are a lot of discussion about Africa is going to be the place where we're going to test the vaccines or trial vaccines. So in a standard epidemiological practice, what determines where you roll out test vaccines first? So is it area of existing widespread or area of less of economic importance or whatever? What's the professional standard? So you can answer the question now.
Okay. Should I start answering all the questions now?
Yes, yes, sir.
Okay. So the first one, the question was, can you contact COVID-19 through currency? So, and the answer will be yes, because if someone that has the infection has any body fluid, like saliva, sputum, or even holds the currency, and the fluid is on that. So what we do not know is how long the virus can stay in us, because like every virus, what it does, the character of the virus by itself, if it's lying outside the human body, outside not just the human body, outside a living thing, it's harmless. So because it doesn't have a full constitution of a cell, it only has a limited period by which it can survive without any support, because it needs food and nutrients. So it needs to get into a cell or a kind of a living thing. So as long as that virus is viable on that currency or on the table surface, on anything, and another person that doesn't know comes in contact with that, and that currency, it comes in contact with your mouth, maybe you touch it and then you put food in your mouth, or you touch you pick your nose or your ears, as long as, so it gets into, how does it get into the human body? It gets into the human body through mucous membrane. And where is the commonest mucous membrane? Is the mouth, the nose, the nostrils, the ears, and our eyes. And these are the things that we touch constantly. We scratch out, the eyes, you rub your lips, put food in your mouth and stuff like that. So yes, it's a possibility. Now, the issue of chloroquine, I believe from all the information we have so far, the reason why chloroquine has come into light as a potential drug is because the President of the United States, who is the most powerful human being on earth and has the biggest stage, because when he talks, the whole world listens, because he's touting the same medication. And we know the way the president behaves in terms of when he wants something done, when he wants something, he pushes it. So that's the reason. Because till date, the only two scenarios that gave hydroxychloroquine credibility. The first one was the SARS, the other like cousins of COVID and MERS. They tested because all of them are coronaviruses too, and they essentially have the same constituents with just minor changes. So they tested those organisms. They tested them. They tested chloroquine on them in test tubes.
Hello, doctor.
Yeah.
I'm sorry, we're a bit constrained. It's a pity. We actually be ending the session.
So just to be quick. So bottom line, there was only one study that was done, and there were 20 patients that they used in France, and every reasonable scientist has said that study should not even have been published in the first place. So there's no credibility to it. However, people use it as a drug of last resort. If you don't have a choice, try. What do you have to lose? The patient is going to die anyway. So we're using it, and so yes, we do use the medication in New York and some other parts of the state, and it's used